afternoon to members of the media who are once again helping us to communicate with you during this COVID response. A very special welcome to the people of Tobago, among whom I sit at the moment and sharing this broadcast with you this afternoon. Today is, as we welcome you to our regular update on our COVID-19 response, it's interesting for us to just have a little look backwards as to where we are and where we came from. 9 months ago, we were called upon to pay attention to the existence of and coming to us of a virus which had the potential to be very detrimental to our lives and our livelihood. We started by responding in a way to reduce the possibility of the virus inundating us, but I don't think we ever expected that we in the world, in a pandemic, would never be touched by this virus. We made plans for when we were, in fact, touched by it. Our initial plans were to not allow easy passage from region to region, and then later person to person. Then, of course, we had our first indications that the virus had come through our borders in Trinidad and Tobago, and we took steps to ensure that the virus did not explode among the population, and we gave it as little opportunity as possible to propagate. But of course, the nature of the virus being what it is, and the nature of the pandemic, the epidemiological responses and expectations when we are part of the world responding to this virus, we had to expect that what other people were seeing held out that kind of potential for us to also see it. So we had the shutdown of the country and had all kinds of very serious consequences. And then we kept our position, kept responding in a serious way. And for many weeks, we had very low infections to report. And as we came back out of the lockdown and put more people out there interacting, as is to be expected, we saw a spike of the showing increase in the virus among the population. We looked at that for a while and we tried to make sure that we had the infrastructure in place to respond in identifying and responding to those who need healthcare and support in one kind or another. And then the numbers started to get, even more concerning. And a few weeks ago, in one of these press conferences, you were told of the decision that we made to not lock down the country, but to reduce a significant number of people in the marketplace and public transport. We kept our schools closed, we kept our borders closed, but we kept on running our economy as best we can, bringing home people from abroad in a very managed way. And we also kept our public service functioning, and the business community kept going along with their business. So we have been responding to the virus in a way which, simply put, is that we have been living with it because we don't have an opportunity to eliminate it. There is no, in the very beginning, we were told that the nature of the pandemic, the behavior of the virus, the epidemiological history of these things is that this virus could be with us for a year and a half, 2 years. These are just guesstimates being made by the experts. But in terms of planning for the arrival of the virus in the population and the expectation of what is likely to happen, our first horizon, we looked at September. So cast in mind back to January, then March when we had our first step. So between March and September, that's the period that we have planned for considerably. And we are now in September, and it is good to look backwards now to see what we thought then and what we are experiencing now to see whether in fact we were successful in managing this infection which came to us as part of the global pandemic. By and large, I would say that we have done reasonably well in terms of managing our response, and the best yardstick that we can use is that we have had our health infrastructure prepared and ready to provide support in terms of identification, testing when we were in the sporadic stage. Then we got to before we got to the community spread, we were at the cluster stage and we identified those stages and responded accordingly. And unfortunately, we've lost 70 people in a situation in the world where 1 million people have died from this virus in Trinidad and Tobago. Our sad contribution to that is 70. And we trust that we can keep those numbers as low as possible, because every life lost is a blow to a family and a trauma to a community and the nation. But it could easily have been worse had we not been a disciplined people and took the decision to make the sacrifices that were required. At the meeting, at the update where we decided to send public servants, 50% of them home, and to go back to essentials in the public service largely, and to close our beaches and to reduce our travel to Tobago in our attempt to keep Tobago as virus-free as possible. All of those things we did at the update about a month ago, with the expectation that what we'll be doing is suppressing the propagation of the virus in the population, ensuring that we are never at a stage where if healthcare is required by any person, that healthcare is not available because we have been overwhelmed by the rate of infection. Today, I would like to ask the doctors to give us their report as to where we are now and looking back on the week, and how we have fared given the decisions we have made to reduce the exposure of the population. So now I would like to ask Dr. Parisham and his team to give us the medical inputs of Trinidad and Tobago's position at this time.
Okay, thank you, Honorable Prime Minister, Honorable Minister of Health, Dr. Michelle Trotman, members of the media, members of the viewing and listening public. We first go into the clinical update, which is for today, Saturday, 26th of September. The total number of samples submitted to the Caribbean Public Health Agency as well as the University of the West Indies sites, other sites including North Central Regional Health Authority, Eastern Regional Health Authority, Southwest RHA and Tobago, 30,544. Number of unique patient tests completed, 27,481. Number of repeated samples, 3,063. Number of samples which have tested positive for Trinidad and Tobago, 4,285. Total number of active cases now stand at 2,030, representing a recovery of 53% of our patients so far. Number of deaths at 70, and number of persons discharged from the public health facilities, these are the hospitals and the step-downs, 914. Number of recovered community cases, 1,271. In terms of our hospital capacity at this point in time, so at the Couva Hospital and Multi-Training Facility, we have 54 persons housed there. 5 of those are in intensive care units. 8 of those are in high dependency units. At the Cora facility, there are 24 persons. None of them are ICU or HDU type patients. They're all well ambulatory. At the Arima facility, there are 4 persons in the ICU, 6 in total in the hospital. Augustus Long, 1 person. At the St. Anne's Hospital, there are 10 positive persons housed in a parallel system within the St. Anne's compound. At the Scarborough Regional Hospital, there are 5 persons, and at Signal Hill, there's 1. By way of our step-down facilities, we have our Canada Hall facility and Freedom Hall at UWI, having 52 and 45 individuals respectively. In Tobago, there are 9 persons being housed in step-down. With regards to quarantine sites, we have a total of 234 repatriated nationals at this point, spread between 6 facilities. The Chancellor Hotel has 19 persons, Cascadia Hotel there 43, Home of Football 24, Paria Suites 78, and at the Day Bay facility 32, representing a capacity of 62% of the quarantine sites. If we could go to my first slide, please. So again, this is the epidemiological curve, not by date of reported sample, but at date that the samples are actually being, the persons are actually being swabbed. So again, starting on the left of the screen, you see light blue charts which represent July, the purple represent August, the darker ones to the right represent September, so dark blue. If you look at that dotted line, there's a small dotted line that goes across the entire graph. So the way the dotted line is calculated is that we take the previous 7 days of bars, we add those together and we get an average for the past 7 days. What we need to pay, of course, we see the dotted line going throughout. There's a peak in the middle of August, around the 17th of August, and then it begins to slow somewhat. Coming into the latter part of September, there's a bit of a threshold point that we reached where you saw a bit of a plateau. And now the more important part within the last few days, 3 or 4 days, we are seeing a down tick in that dotted line, which is what we are hoping to see. So we are seeing that curve is bending downwards. Within the next few days, as the data continues to come in and populate that part of the curve, we'll have a very good idea as to how it pans out. But over the last week or two, if you follow the dotted line, you will see that it averages out to just about 40 cases per day over that period of time. So based on a sample size of about 600 to 700 cases, giving us a positivity rate anywhere on a given day, between 6 and 9%. So we want that positivity rate to come down, and we want the numbers per day to come down as well, which we are seeing some promising features as the dotted line heads downwards towards the line indicated on the left, 20 cases per day. If you go to the other slide, and again, just giving an idea of the way the cases are distributed by way of the population in terms of the sex distribution, we see a slight predominance of males, 53% versus 47% for females. If you look at the chart below, which gives the age, and in terms of the persons infected, we see 16.47% in those less than 25, 56.43% those 25 to 49. If you add those two bars together, meaning persons less than 49 years of age, we get 73% of our population is affected that are less than 49 years of age. If you go to the 50 to 59, we saw 14.36. Again, 60 plus, 17% roughly, giving us 100% in total. If you look at the left chart, which gives you the blue and the pink graphs on the left horizontally, and you focus on the graphs between 30 to 39, you find that those are the largest graphs that we see, both for males and females. If you add them together, between 30 and 39 years of age, we find that more than 30% of the cases lie in that band of population. So just by way of epidemiology, that's where we stand now. We are seeing the downward trend based on the previous graph, and with the continued efforts of the public in terms of maintaining the public health measures, I think we will continue to see that downward trend occurring, barring any unforeseen circumstances. If you allow Prime Minister Dr. Trotman to just go a little bit into detail again with our public health measures. As you know, the public health measures are the mainstay, the most important tool that we have to control this virus. There's no vaccine, there's no specific treatment. What we rely on is the majority of the population abiding by our public health guidelines to ensure that we get that virus level down, we stop it from moving from one individual to the next, so that we flatten the curve as much as we can. So Dr. Trotman, if you can give us an update on the masks in particular.
My pleasure. Honorable Prime Minister, Minister Dayal Singh, Chief Medical Officer Dr. Pasram, my fellow colleagues, members of the media, members of the viewing public. It is with great pleasure I come today. I come to say thank you, thank you, thank you to the public for the support that we have received as a medical team in terms of our fight against COVID-19. We have asked 3 simple measures along the way. Number 1, to sanitize, and you have done that. Number 2, to distance, and you have done that. And number 3, to wear the masks, and you have done that. So again, I say thank you. I must ask those who are not yet doing it to please join, because you can see, as Dr. Pasram has outlined, you can see how effective it is. 3 simple measures as we move forward that we will have to continue in our fight. We will have to continue to sanitize. We will have to continue to distance. And we'll have to continue to wear our masks. It's now part of who we are. I want to ask each of us to take a responsibility that if we see someone who is not, that we could try to encourage them to do so in a way that you might be able to reach out where I might not be able to reach out. The bottom line is, if we get 100% compliance, and Trinidad, I know you can do that. If we get 100% compliance, those numbers will continue to go down and stay down. I want to emphasize, even as we look into the flu season coming on, that the wearing of the mask also helps our healthcare workers, because it helps us against the fight against the flu also. We encourage that when the flu vaccine comes, that of course that we would all partake in the flu vaccine, and we look forward for a day for the vaccine for the coronavirus. But in the meantime, I'm asking each and every one of you 3 simple things. Sanitize, distance, and wear your masks. Thank you.
Thank you very much. And we go back to our Prime Minister, please.
Step back to you.
Hello?
Yes, we can hear you, Prime Minister.
Okay, sorry, I wasn't hearing you. Sorry about that. Could I ask the Minister to give us the global perspective, to put our situation in perspective, please?
Thank you, Prime Minister, and thank you for that opening. Prime Minister, the world, especially the Northern Hemisphere, is going to enter a very, I want to choose the right word, but I think the only word to use is a dangerous phase. As the temperatures drop in the Northern Hemisphere, as fall and winter months come in, those areas are going to be hit now with twin viruses, the coronavirus and H1N1, as Dr. Michelle Trotman spoke to. To date, 32,941,319 persons around the world have contracted the virus. And to date, 996,254 have died. By tomorrow, given the current rate of mortality, the world will be plunged into some degree of sorrow, where we recognize the millionth death. There is no vaccine yet for COVID, but we are now at the start of our flu season, where we have to vaccinate against H1N1. Trinidad and Tobago has ordered 200,000 doses of H1N1 vaccine, 100,000 of which arrived in the country on Wednesday. The flu vaccination drive starts next week, Tuesday, the 29th of September, utilizing the first 100,000 which came in on Wednesday. We strongly recommend and urge the at-risk groups, which are quite similar to COVID at-risk groups, that is the elderly, those with diabetes or commonly called sugar, those with hypertension or commonly called pressure, our pregnant population. We are focusing, not exclusively, because we are not going to turn away anyone, but we are urging those at-risk groups, that is, those with diabetes, those who are obese, those with asthma, those who are pregnant, to make full use of the free vaccinations provided by the government. We start next week, Tuesday. The H1N1 is what we call endemic to Trinidad and Tobago, means it is found everywhere in Trinidad and Tobago and has been so since 2009. The following clinics are set up to serve you. 1. All our antenatal clinics, that is where our pregnant women go for their checkups. Please make yourself available to receive the vaccination. It is perfectly safe for you and your unborn child. We'll be giving out the vaccines in all the chronic care clinics. That is all the clinics that cater to those with diabetes and so on. And as an additional point of convenience, for the first time, we have designated 2 health centers in each county, and that will come out in subsequent communications. 2 health centers in every county where you can go and get your H1N1 shot 5 days a week, Monday to Friday. Tobago, under the acting CMOH, Dr. Tiffany Hoyt, they will roll out their own vaccination plan. So, Prime Minister, thank you. As I said, 32 million cases. Tomorrow, we will touch 1 million deaths. And we are asking persons, there is no vaccine for COVID, but we do have a vaccine for H1N1 available to the population from Tuesday 29th September, and there will be future detailed communications directing you to these centers. Thank you, Mr. Prime Minister.
Thank you very much, Minister Dayal Singh. I just want to ask Dr. Paraswan to make a couple of comments on one of the exhortations that we made in the context of the protocol, and that has to do with a person who appears to be symptomatic for the flu. As we're talking now about coming out of the flu season and vaccination for the flu, what do we do if you are thinking that you are ill or you're seeing symptoms of an illness that appears to be flu-related? Could you just reinforce that at this time?
Okay, thank you, Prime Minister. So, the flu, as Dr. Trotman would have begun to explain, what we describe as the flu, which is the influenza virus, and COVID-19 have very similar symptoms. They have similar modes of transmission, both of them being transmitted by respiratory droplet infection. The signs and symptoms are almost identical, especially in the first few days of infection. So therein lies there's very difficult for the population on the whole to determine, even when you go to a clinician, determine at the outset if you're dealing with the influenza or you're dealing with COVID-19 without having a test performed. Extremely difficult. So we ask that the same, once you get signs and symptoms suggestive of either of the viruses, that you quarantine, which is the most important thing. You don't go to work or go to school when you're ill, expose anyone else to the vaccine. Of course, if you have mild symptoms, you can stay at home, stay in that quarantine setting. We can reach out to our hotline. The COVID-19 hotline will be used for any sort of viral illness related to the respiratory system as well, for clarification. And of course, most importantly, if you have deterioration of symptoms, you have shortness of breath, you have worsening, you have vomiting, diarrhea, you're not able to eat well, or in children feed well, then of course you go straight into your healthcare facility, you contact your healthcare worker, or if it is extremely debilitating, you contact 811, use the emergency services and get to a facility as quickly as you can. The difference between the two, of course, there's a vaccine, as Minister would have indicated, for influenza, which is one of the cornerstones of prevention. So we are asking, as Minister said, once you're in the high-risk groups, we try to get our vaccine level as high as we can in the population, so persons that can be vaccinated will, of course, less likely to present symptoms of the flu, and if you have symptoms suggestive, it will be something else. Maybe COVID-19, maybe common cold. So, Prime Minister.
Thank you very much, Doctor. Given that we are saying to people, stay home if you are ill, and we expect that quite a few persons could contract illness with respect to the H1N1, and there would be an anxiety there when presentations are made. Where does the testing program come in here? And if persons are desirous of being tested to determine the nature of the illness, how prepared are we to respond from a testing standpoint?
Okay, so I think in terms of our testing capacity, we are now closely up to 1,300 samples per day by way of doing COVID-19. We are seeing anywhere between 600 and 700 samples coming in to the country, throughout the country when we add all the aggregate sites together, 600 to 700. So there's a surplus in terms of COVID-19 testing. The way we test for influenza is through the Caribbean Public Health Agency. So what we will, once the flu season begins, which is in a few days, the Caribbean Public Health Agency, once something has ruled out COVID, once we have said you have a negative COVID-19 test, especially with severe symptoms, then that sample is transmitted through the Trinidad Public Health Lab to the Caribbean Public Health Agency. They will run a full respiratory panel which includes H1N1 to determine if you have H1N1 or not. Of course, having a history of a vaccine decreases your risk, so that will be asked by the physicians as well when they take your symptoms and they do your swabbing. So that is the way we stand in terms of COVID-19. We can rule it out now more or less pretty quickly within 24 to 48 hours. We have also had an order in with the Pan American Health Organization for rapid antigen tests, which will actually be able to tell you within 15 or 20 minutes whether you have COVID-19. Those are scheduled to arrive early part of November based on what we have know so far from PAHO. So once we have those tests, we will be even more quickly at the emergency department level, tell you don't have COVID, and then of course we can send those samples onward to the public health agency so they can say what other virus exists at that point in time.
Prime Minister, one of the questions people always ask about the flu vaccination is that if I got vaccinated this year, do I need to be vaccinated again? And the answer is always, this is an annual shot, meaning every flu season you need to be vaccinated. The vaccination you got for last year's flu season, and the flu season runs from October of any year to May of the following year. So last year's flu season would have started in October 2019 and finished in May of 2020. So even if you got your shot in May of 2020, you still need to take your shot for this year's flu season, which runs from October 2020 to May 2021. So it's an annual shot. It's every year as the virus changes from year to year. Thank you, Honorable Prime Minister.
Thank you very much, Minister and members of the health team. Given what we have raised here today and advised the population, I trust that it will be clear that we do have an organized system of clinical response, and that there are things that the individuals need to do to be observant and to be cooperative at your level. And if you do need to get further support and involvement of the health team, you communicate and share the infrastructure that we have. We try to ensure that the health system is able to respond to the situation as it may develop with respect to normal flu, and we call it that, and of course the new virus, which is the COVID-19. We did say that we needed a certain period of time to bring down the levels of infection which we started out with last month. And we said that we would look at it, and by the 11th of September, which is a week away from now, we would have had sufficient time for incubation and infections occur, and for us to map and follow them, and to determine what level of exposure is anticipated or is expected as a response. And given the numbers that we have now, we are concluding that the system of withdrawal and restraint that we have is working to our benefit, because it appears from the average, the curve that is based on the average, the weekly average, that things are, the level of infection has been reduced, and we will want it to continue to be so, because even though it has been reduced, it is still too high. Let me just mention that at 40, an average of 40 persons per day on your rolling week average is good as compared to when we were well above 100 and so on. But in the context of where we're aiming to be, especially since we want to participate in regional and international contacts, there's something called a bubble, which the Caribbean governments are trying to work out, where we can all get to a certain level, and I don't want to use the word acceptable, I want to say a level that we can deem to be really, again, I don't want to use the word comfortable, but that's the word that we should be using, that the level of infection is low enough for us to mix and mingle without resulting in an explosion. Once you have an explosion, you are forced to take very drastic action. You will see one Caribbean country, which would have opened up a few weeks ago, and soon after, there was a major explosion in the infections, and that country had to shut down and go into even more drastic closures. And only today, or was it yesterday, the I.A.N experts were warning that as we take the withdrawal as part of our management, and we come out from stages of withdrawal, that we should not do so with too much speed, because to do that is to increase the level of risk, and it can be counterproductive. So what we're being advised by the experts who look at the whole world's program and give a worldview is that as we're coming out of periods of withdrawal, that we do so slowly and carefully so as not to risk. That being so, we here in Trinidad and Tobago, being in the state that we are in now, with the decision that we made in the last few weeks and seeing the results that we've seen, today I simply want to ask the country to continue with the prescription that we have made and that appear to be working. So today there will be no new legislative change to what is on the books. The legislative authority for the changes that we have made will stay, they will remain in place until the 11th of October. And hopefully, if we continue with the cooperation that Dr. Chapman has pointed out, and if those who have not been participating join us, participate, we have every reason to believe that we will continue to depress those numbers. And we are aiming, our next target with respect to the depression of the numbers is to try to get down to the vicinity of 20 infections per day, which is what the Caribbean leaders have set as a target to participate in this bubble, where if we get down to that level of 20 infections per day or less, we can then interact with the people of Grenada, Barbados, and Lucia, and then have some kind of economic contact and travel arrangements between us. But in the meantime, if we are not down there, then we are outside of the target that is set. So we have set that as our target to get there, to be able to participate, because that participation has serious economic implications for all of us. And then also we are continuing to bring home those persons who went out and were left outside when the borders were closed. We keep working assiduously on that. We've been granting a exemption so they could make arrangements. And we do have a number of flights coming in on a fairly regular basis, bringing people home. And you can gauge that by the number of persons we have in quarantine facilities or step-down facilities. Because these people, when they come home, they're the ones who are largely filling up those facilities. And you will also gather we have a number of facilities which are playing a role for different levels of exposure and personal condition. We expect that when we meet next week, if we do not reverse our trend, when we meet next week, we should be able to take one or two decisions that would allow us to, again, very cautiously step out and go back to some, we are aiming to get back to some semblance of full participation. I wouldn't say normalcy at this stage, but full participation. So where the participation has been constricted, next Saturday, we'll have one more week of this level of withdrawal. And the advice that I have from the medical team is that one more week going in this direction to bring us to a place where we can begin to think about further participation. So let's keep our fingers crossed on that. So that's we're looking at end of the first week in October. And of course, when we did start up in this direction, we did say that by October 18th, we expect that the good results of the good behavior during this period should put us in a place where we're not dealing with a spike, but we should be dealing with suppression of the infection rate. So today, it's a very simple statement to make that we are not making any changes. We steady as we go for another week at least, and hopefully we will see the improvements that flow from that. If this is the time for questions, if we have another few questions now.
Thank you very much, Prime Minister. And we move to the question and answer segment. Our media representatives are asked to state their name and the name of the media house that they represent before posing their question. Because our time is limited, we request please a maximum of 2 brief questions. Prime Minister, I see that AZP News is ready with their questions.
Hi, good afternoon, Priya Bihari, AZPnews.com. Good afternoon to Prime Minister, good afternoon to Minister of Health, and all the doctors and candidates. And firstly, let me just wish the Minister of Health happy birthday. I understand there is a birthday, Minister of Health, happy birthday.
Thank you very much. Thank you.
And my first question is for you, Minister of Health. There is
is that my birthday present? The first question.
There is an infestation of cats in the North Valsin area, and the residents are concerned that it may spread the COVID-19. It is causing a nuisance in the area, and I want to know if you can intervene as the MP for the area and also as the Minister of Health, because they have called a number of the shelters, and the number of the shelters say that they are full the capacity, and I want you to intervene with that. That's my first question.
Thank you very much, Priya.
And my second question is maybe to the CMO. I know that Dr. Parkinson recently spoke about the number of patients in the ICU, etc. I just wanted to know if you get the figures of the number of patients in ICU who have passed on, and any patients who may have left the ICU and have been discharged. Thank you.
You want to go first?
Yeah, so thank you, Priya. So the issue of cats in Valsin is a very touchy one, because half of the people want the cats and half of the people don't want the cats. So I am caught in between. But the catching of the cats or animals is a function of local government. So I will be sure to pass it on to the local government councillor to see what they can do. So thank you very much. I know my yard has about three of them.
Okay. So in terms of your ICU, yes, I said this morning we had at the Couva Hospital, we have 5 persons in the ICU, 8 persons in the high dependency unit at this time. I believe in Arima we have 4 persons in the ICU as well. The question I think you're asking is, have people been able to recover from ICU and HDU? Yeah? So, all the way back to the first phase, we had a lot of persons being in ICU, some of them for a protracted period of time, maybe a week or 2 weeks, and they have been able to recover. So persons have been into the ICU and the HDU and been stepped back down, of course, to the normal hospital wards, and then, of course, eventually discharged back to their loved ones. So that has happened on a number of occasions throughout the phase 1 and phase 2.
Thank you very much, CMO. And Prime Minister, next we have 98.1.
A very good afternoon to the Prime Minister and the rest of the panel. Stephen Cummings, 98.1 FM. Just two questions. Want to probably, I probably can just start with the Prime Minister. Prime Minister, there were attempts earlier among yourself and some of our CARICOM neighbours, and you referred to it, to create what was described as a bio-bubble of some sorts, with the aim of engaging some kind of economic activity within the region. Since that last meeting, has there been any other discussions or further developments regarding such an initiative? And Minister Dayal Singh, we have spoken before about the important principle of doctor-patient confidentiality, but I've seen where many patients themselves breach, at times those principles, especially when they may feel aggrieved or unhappy about the standard of care that they may have received. I'm interested to know how you treat with such a situation when some patients are willing tale bearers, creating a dichotomy of some sorts. For example, I've seen it with the release of COVID-19 patient results. Thank you.
Yeah, let me just mention, let me take the first question, the bio-bubble. Yes, we did have a fairly extensive heads of government meeting of this nature, where the requirement is that we get to a stage where we can have scheduled international flights. All of us want to be in that situation, but the nature of the problem was such that what was holding us back was how do we have those flights coming into our territory and not have that become a threat to our own interest in terms of spreading of the virus. And then it comes to who persons should be tested and coming virus-free. Once we are able to determine that persons who are not carrying the virus, then they should be allowed to come in. And then the other question that arose was, how do you determine that they are virus-free? What sort of testing regime? What sort of certification you would require? And is it testing before they leave a home, their home country, or testing upon arrival? And what period of time should that testing cover? Are persons required to be tested just before they embark and come to the country? Or should they be tested before so that the period of incubation could be ruled out? And the answers to all of these questions were such that it created a huge uncertainty gap. And the Prime Minister of St. Lucia, which is St. Lucia being a country that has been relatively low infected, you had the question of persons being required to be tested 7 days before they travel. Only yesterday you've seen a Bloomberg position on the Prime Minister of St. Lucia advancing that as a possible yardstick. But then because of the nature of the virus, and it's one could test early and be negative, travel, and then later on you are still in the incubation period, and then you test positive. But in the meantime, if you have mixed people, other passengers on the plane, as well as people in the country that you arrived at, you have a big problem now because the person who was positive had been circulating. So all of this led us to a position, I just mentioned, that the level of infection, the rate of infection, the level of exposure should be relatively low if the national infection rate is 20 or less per day. Now that is a yardstick that I think the experts here, the health person, the epidemiologists who look at the numbers and determine the risk that's involved. And it was determined that if the numbers are in the vicinity of 20 or less per day in a community, then one could reasonably expose oneself to persons coming from that community and not be unduly exposed to the infection. So that is where we are with that, and some Caribbean countries are beginning to use that yardstick and opening their borders gently to those testing regimes. And so there are categories of countries now. There are countries that are deemed to be high risk, where the infection level is high, and like the United Kingdom and the United States, unfortunately, those are our main suppliers of passengers coming to us. And then there are low-risk countries where the infection level is lower. And the heads of government position is that from low-risk countries, we can begin to think about having them come in with an acceptable testing regime. And to participate in the bubble, you need to be 20 or less per day. So I trust that that answers your question.
Thank you very much, Prior. So I will now answer your question on patient confidentiality. If we take the doctor-patient and the lawyer-client relationship, it is not a two-way street, it's a one-way street, meaning confidentiality only applies to the lawyer or the doctor. We are not allowed to give out patient details, but the patient or the client of a lawyer is allowed to speak freely without fear of any retribution or anything. So in health, we are always faced with that issue, and it's something we can't fight against. But I will say, coming out on social media yesterday was a glowing tribute to the health system dealing with COVID. And that is the norm, actually. That is the norm. That is what happens in 99% of the cases. What that gentleman had to say is the norm. But the norm does not grab the public's attention. It is always the one thing that goes wrong. But that is how patient confidentiality works. It's a one-way street. Thank you very much.
Thank you very much, Minister. Prime Minister, we go now to TTT.
Good afternoon, Ian Wilson here from TTT News. We have some students in university who were first told that they needed to be at the university for the semester, but having reached across, they are now being told that they didn't have to come, and now they, because they can have the classes online, and now they are waiting exemption to return home. One of them is actually sick and is in need of medical attention, so they're asking how soon, when, what priority they would have in coming home.
Well, the Ministry of National Security is managing a whole plethora of requests, and I monitor it, and I'm satisfied that the decisions are made in the most reasonable way, and where there are urgencies, the Ministry would intervene. The biggest problem is that we don't have scheduled flights. Because we don't have scheduled flights, it complicates the repatriation process. One has to first, we have granted a lot of exemptions to people, and some of those people, their big difficulty now is, how do I get on transport to get home now that I've got the exemption? I did say a little earlier on that I was asking the ministry, and I did do that, ask the Ministry of National Security to increase the rate at which we are exempting people to come in. That's why I said earlier on that most of the people who went out on short stay and wanted to come back home are either already in or scheduled to come in. And we are now observing that some other people are joining the lines, and these are people who have been resident abroad and are now determining that the best place to be is to come back to Trinidad and Tobago. But we have been giving priority to those who are domiciled here and went out and got caught by the announcement of the closure of the border. And in the case of persons that have specific problems that require urgency, the ministry will give some priority to that. But then the whole question is, how does the transport mesh with that? And until we get to a point where we are able to improve on the transportation, we will have those decisions to make. But we've been dealing with a lot of them. Some of them came directly to the minister, one or two of them come to me, but the ministry is making that. I try to get as many people in as possible now. And one other thing that we're facing is that it is a little bit disappointing that sometimes you go through all these difficulties to make the arrangements. And when it is time for people to travel, having been given the option to travel on the limited transport, quite a few people are now suddenly dropping out and saying, well, look, I'm not quite ready, or I didn't really mean to come at this time, and so on and so on. And that only complicates the issue for us. So we're hoping that we will continue to get them in as quickly as we're able to. But there will be a difficulty as long as the transportation is sporadic.
Thank you very much, Prime Minister. And now we go to TV6, please.
Good afternoon, everyone. Urvashi from TV6, and best wishes to you, Minister of Health. Turning to our CMO, Dr. Parasram, I've spoken to a few medical practitioners who've said that the symptoms experienced by COVID-positive persons during phase 1 was in fact different to symptoms experienced in phase 2. Is this in fact so, and what would attest to that? Could it be different strains, for instance? Second question, Mr. Prime Minister, good afternoon. Given the threat that unchecked migration can have on the spread of communicable diseases, up until a few days ago, we saw that the police did in fact cite some illegal immigrants on our borders. And 3, our country has been criticized by the Human Rights Watch on the repatriation of Venezuelans illegally here back to Venezuela. What more can be done to secure our borders, because unchecked migration can also impact this bubble? Thank you.
Dr. Parasram, can you take the first part of the question, please?
Okay, so what we know about COVID-19 right now is there are at least 6 different subtypes of the virus. The one that originated in China is designated as type L. They all have subtle variances. From what we heard from the virologists at this point in time, they seem to not have a great impact on the virulence and the infectivity. So they are not great changes in terms of mutation. So they are subtle changes, but they have 6 subtypes that have been defined. In the Caribbean, the University of the West Indies, partnering with the Caribbean Public Health Agency, as well as UE, as well as the Ministry of Health, is in the process of actually taking samples from both the first phase and the second phase patients, not only in Trinidad but in the other parts of the Caribbean, to determine what subtype we have in this region and if there has been a change between the phase 1 and phase 2. Anecdotally, in terms of the patients that we have been seeing, we have seen a greater level of transmission. So there seems to be a slightly different level of transmission between phase 2 and phase 1. Again, it can be a function of the types of persons being infected. As we said, 73% of the people are now less than 49 in Trinidad, for instance. So the symptomatology, of course, will be different based on the types of people that are infected. In the first phase, we would have had people being infected. The average was, I believe, 56 years of age. That average has dropped significantly with the second phase. So you expect that a younger population being infected, of course, will have milder symptoms than an older group of people that have symptoms that will be based on, of course, their comorbidities, having diabetes, hypertension, and the like. So it is a function of who is being infected, more so maybe than the actual viral strain. However, I think we have to wait until UE has conducted their study before we can have a definitive statement as to whether there's a true change in the virus itself. Prime Minister.
Thank you very much, Dr. Parasram. Urvashi, thank you very much for your question about this whole question of unchecked migration. Let me just say definitively, Trinidad and Tobago does not have unchecked migration. It is because we have checks on migration that you see news items from time to time that persons from our neighborhood, and by neighborhood I mean Southern Caribbean mainly, Venezuela, and elsewhere, that persons are apprehended for coming into the country improperly, illegally, or attempting to come into the country. That if we had unchecked migration, well, anybody can walk through anywhere and come in. That is not happening. We have, from the major problem we had in that situation was Venezuelans crossing by sea into Trinidad and Tobago. We did identify them, those who were in the country, we had them registered, they're comfortably in Trinidad and Tobago, and others who wanted to come in. We have a visa system, and the existence of the visa system is in force, and we also have increased patrols. Even before COVID-19, we were ensuring that we did not have unchecked migration. We were stemming migration by stopping people, or if they did get in, we apprehend them in Trinidad and Tobago, we restrain them, and we repatriate them. Only recently, we repatriated about a number of 160 persons, and sometime before that, we repatriated about 200. And our policy is to repatriate persons who actually make it through illegally. And therefore, it is not correct to say that we have unchecked migration. And with respect to ensuring that we keep our borders as closed as possible during the period of closure, and even before closure, that we determine who comes in and where they pass to come in and how long they stay, which is our immigration exercise. We use all the resources available to the Trinidad and Tobago security system to ensure that we do not have unchecked migration. The police, the defense force, and other state security agencies are always at work looking out for persons who are attempting to come into our country or who have come into our country legally. And if they have come into the country, there are times when you would see that persons have been picked up for being here illegally, or you would see that the Coast Guard have stopped transports in the waters outside of within our border, and we then will handle them in a particular way. So we do have attempts at migration all the time. All the time there are people attempting to come into our country, but it is not unchecked.
Thank you, Prime Minister. And we move now to Radio Tambrin.
Good afternoon to the Honourable Prime Minister, Minister of Health, and the doctors and other persons present. Clayton Clark, Radio Tambrin, 92.7 FM. My two questions. The mention was made that there are more men testing positive for the coronavirus. Any research or analysis of that data has been done? What is it saying? Is it a cause of for concern, and anything that being thought about to address those numbers? And secondly, the transport of patients, corona positive patients from Tobago to Trinidad has by largely been good. Smooth transport, with the exception there was one issue of a patient raising concern about the conditions on the Coast Guard boat, and they gave a sort of grim picture on one of our media houses a couple of days ago. Has that issue been brought to the attention of Dr. Parasram? What has been done to address, if it was done, if the issue was raised, what has been done to address that concern? Thank you.
So when I showed the graph earlier, basically 47% of the persons infected are female, 53% are male. In the grand scheme of things, that is almost 50-50%. So I don't think there's a great difference between the two. A slight male predominance. However, having said that, we are looking at target groups for persons infected. As I said, that age group 30 to 40 and the age group less than 49 in the population. When we target our media campaigns and our communication campaigns, we have to look to those age groups of people being infected to have targeted campaigns as well to determine, so that we can bring the rates of infection in those groups of people down. So it is a good start with the general male and female, but I think more importantly, we're dealing with the age groups. To target our population campaigns, it needs to be targeted at those age groups predominantly that are being infected more frequently. With regards to the Coast Guard, I'm not aware that there was any conditions. However, I will liaise with Ministry of National Security to see what is the issue with regards to that. But having said that, the number of transfers between Trinidad and Tobago are now very little, because Tobago now has the capacity to treat their patients in-house by way of their ICU, HDU, and hospital centers. Only if the capacity is outstripped, then they will be coming to Trinidad. In the early days of the epidemic, every positive that they had would have had to been transported across, but that has now changed, and they can now house their patients in Tobago.
Thank you very much, CMO. And we move now to CL Communications, please. CL. Communications. And so I will move swiftly to Express newspaper, please.
Hi, good morning. Camille Hunt, Express. Prime Minister, you spoke about the repatriation process and scheduled flights not being available. Forgive me if this was addressed before, but I'm having audio issues, so I might have missed it. But every day I'm getting emails and messages from people in different countries saying that they've applied for exemptions, but they haven't received any response. And they are willing to charter their own flights, but they're not hearing anything from the Ministry of National Security. So what is the holdup in getting persons home who are saying that they can charter their own flights? Also, some time ago, the minister had said that financial aid would be sent to certain embassies so nationals abroad can access it if they need assistance. But we're hearing stories every day of people running out of food, running out of money, out of medication. What is the status of that aid? And has anyone been able to access it so far?
Well, I do not have any data with me right now about what is being accessed abroad, but I know we did take steps to have small amount of emergency money available at 2 or 3 of our missions abroad. So clearly, we wouldn't be able to reach every person who is everywhere. And with respect to the rate at which persons are brought home, there's a nexus between the number of requests and the ability to handle the numbers once they get here. Because remember, once those persons get here, they're not just going straight home, they are going into the infrastructure for managing the exposure. And that is the quarantine, and we've reduced the requirement for that, and we've increased the numbers of the accommodation that's available for that. And that allows us to bring in more people at any one time. So with respect to persons who are not getting a response, I must apologize for that, because that ought not to be so. Once persons communicate with the ministry, one way or the other, they should be responded to be told or to be kept in the loop as to where they are. But the ministry will be making decisions based on what is available. For example, if a person calls in from, say, Nepal, and one calls in from Florida, there's a very long arrangement between somebody in India or Nepal getting to Trinidad and Tobago, because we know that there isn't much of a transportation available there. So you have to work longer with that person before an exemption may be granted or it may waive. Whereas somebody in Florida, if you grant an exemption, then it's usable in a shorter space of time. So these are the things that the ministry will be managing and trying to get everybody from everywhere coming home at different times. But I am concerned about the absence of a response once the person is indicating that they want to come home. That response ought to be there, even if it means that you're saying that we are getting to it, but not immediately.
Thank you very much, Prime Minister. We move now to CL Communications. I think we're ready for you now. CL Communications, great.
Good afternoon. Hearing?
Yes, we are.
All right. I heard Dr. Trotman attribute the public health regulations for the downward trend. I would like to know what contributions do you think the increased rate of testing had to play in this downward trend also? And secondly, yesterday, the WHO said some countries are experiencing problems to get the flu vaccines. So I would just like to know, would Trinidad and Tobago also be affected in this?
Okay, thank you. I'll take the second question first, and then Dr. Trotman will go. So as I indicated, Trinidad and Tobago ordered 200,000 doses of H1N1 vaccine. We received half of that shipment on Wednesday. They will be available for distribution to the public, as I indicated, on Tuesday. The other 100,000 will come in at the start of 2021. Let me just make one last point, because this is something we always get every year. The H1N1 vaccine protects you against the H1N1 virus and not the common cold. So let me just make that point again. This will vaccinate you against the H1N1 vaccine, which is deadly, but not against the common sniffles, the common cold. Okay? So we are, in fact, in possession of 100,000 doses of vaccine right now. Dr. Trotman?
Thank you. The downward and the beginning of the downward trend that we are seeing is largely in part to the behavioral change, we think, to the mask wearing and continued sanitizing and distancing. As Dr. Pasram has stated, we have the capacity to test, and we have been able to test samples, and the samples that are being tested are plotted and then separated out. So the testing aspect and the trend down on the graph are two different things. When we test, we're looking to see how much disease there is and assess the amount of disease. And looking at that assessment, we are able to see the beginning of a downward trend that we are hoping to maintain. And every time I get the chance to talk, I must say, by sanitizing, distancing, and continuing to wear our mask. Thank you.
Thank you very much, Dr. Trotman. And we go to Newsday, please.
Hi, good day. This is Janelle D'Souza from Newsday. I have two questions. The first one is, we heard that right now we have a rate about 40 new cases a day, and we're aiming at 20. However, what was our average previously? And also, I have a question to the Prime Minister from a co-worker who requested that I ask the Prime Minister if he had any comments of the topic, any comments on senior police and defense officers' involvement in a Ponzi scheme linked to criminal gangs and laundering of money.
Okay. Yeah, so when you would have seen the graph, the dotted line again would have shown the 7-day average that we had throughout the country. I think the highest we would have gone above, a little bit above 100, if we looked at the average somewhere in the middle of August. So we are aiming, within the last 2 weeks or so, we would have been around 40 or 50. We want to get that number as low as possible, as low as we possibly can. There's no magic figure that we're aiming at, to be honest, but we're trying to get that figure through the public health measures as low as we possibly can.
With respect to the question about the defense force and police officers involved in pyramid issues, I wouldn't want to respond to that today, because today we want to focus on the national COVID-19 challenges. However, sometime in the very near future, I expect that as I learn more about what is happening in the area of this financial windfall and its legality or illegality, I'll be able to speak to it. I'm still in the learning phase, and on Monday there's an important meeting with national security. I expect to hear more about it and be able to respond better after that, not only coming from me, but from those who are to be quizzed on it. So we have a meeting on Monday, so subsequent to Monday, we can talk a bit more about that. Today we're focusing on COVID-19.
Thank you very much, Prime Minister. I think we have a question from CNC3. Could we please open up for CNC3? I think we had a question from them at some point. If we can't go to CNC3 right now.
Hi.
Wonderful. Please, Ms. Lee, please pose your question.
Hi. Carissa Lee from CNC3. This question is for the CMO. And CMO, we've seen that there have been 48 deaths in the month of September. Does this have anything to do with the home isolation of patients?
No, I think it just has to do with the increased number of cases that we see. So the greater the number of cases, the greater the number of persons affected that are within the high-risk groups, meaning by age as well as by comorbidity, the greater number of deaths you will proportionally see. So I don't think it has anything to do with the transition to the home care. As we would have had Dr. Fraser on recently, we would have had Dr. St. Bernard in as well, speaking to the level of monitoring that is occurring from our home care setting. And of course, transferring of patients as soon as we see any level of risk. We hope to mitigate against any disastrous events in terms of mortality occurring at home. So we have a very robust monitoring and evaluation program through the CMOHs that is to actually ward against any morbidity and mortality through the home care program. Alice?
Thank you very much, CMO. We have come to the end of the question and answer segment, and we go back to the Prime Minister for his closing statement.
Thank you very much all participants, particularly our medical team, and we thank the media for your involvement in your questions. And I want to appeal once again to Trinidad and Tobago to keep acknowledging the fact that we are in a pandemic and we are taking all reasonable steps to ensure that we are not overcome by the effects of a very dangerous virus. The effects are usually not helpful and they are hurting us in a variety of ways, but let us treat that as a temporary phase that we're going through, and we're doing what needs to be done to ensure that we do not become overwhelmed. It was raised during the questioning period of whether we are seeing patterns between the male and the female and who is more susceptible. I just want to remind the population that we have tens of thousands of children away from school in Trinidad and Tobago for many months now. Had they been out there in a normal situation, I have no doubt that the rate of infection would not be the same that you're seeing here in the curve that shows men versus women. There would have been a serious cohort of children in there, and that would have changed a statistical graph. So we have had our children away from school, teachers away from school, and we have also had many other decisions made that are reducing the exposure to the virus. So I don't know if it's a matter of who is more susceptible or who is being exposed more. And that's why the statistical evenness between men and women and those people in the 30 to 45 age group or thereabouts may be the most active people in the country. And again, the more active you become, the more active the country is, the more exposed we are to getting infected. So these are realities that we face, but there's one small reality that we are having to come to grips with. It does not sound exciting, but it is factual, and that is we are having to live with this virus. And we have to continue our lives with it, being cognizant of it, responding in a way that it doesn't get the better of us, but trying to ensure that some semblance of normalcy and participation exists with a virus under control in the way that the health protocols ask us to control it. Today, we make no change to the regulations of public health, so we continue to be guided by the last set of regulations we have, where we keep our beaches closed, we reduce the transportation across the islands, we sail on rivers, and we are legally required to have masks covering our noses and mouths if we are out in a public place. So once you are out, and even if you are in and you are among people, it is helpful to be covered. And those are the things that we have to do as we continue to sanitize. And finally, if you are sick, please stay home. And if you feel sufficiently ill to warrant health care, contact your nearest healthcare department. Thank you very much for your cooperation, and we continue to do what is required to be responsible and to improve our situation in Trinidad. Thank you very much.
Thank you very much, Prime Minister. We have come to the end of today's media conference. Please remember to play your part, follow the new normal guidelines, and wear your mask.